Oh, and the recording will work? Did you
Yes,
test it?
it will. Yes,
Okay.
I did test it this morning 3
Okay.
times. Salam and hello, friends. My name is Bekele-Piper, and I'm so glad you're making time to join us here on Uproot. It has been strange days the last few months as the entire world has slowed down in response to the coronavirus and COVID-19. Really difficult days for so many communities around the world, really for everybody. Everybody has been touched by this pandemic. And I had a whole slate of shows to come to you in the month of March, but in response to what's happening globally, I really wanted to slow down and think again what might best serve my listeners. And so for the next few shows, I'm going to be focusing on coronavirus, but hopefully finding ways to help you build more resilience, joy, and justice, even in the midst of a global pandemic. So I'm really honored and grateful that my good friend, Dr. Michael Chung, is joining me today to help us build resilience so that we have facts about the virus, facts about that will help us keep ourselves and our communities safe. And I am just so glad that he is here. Dr. Chung is a board certified physician in both infectious disease and internal medicine. He is the chair and the professor at the Department of Medicine here at the Aga Khan University in Nairobi, as well as an affiliate professor of the Department of Global Health at the University of Washington in Seattle. Dr. Chung is the founder and executive director of the Treatment, Research, and Expert Education Program at the University of Washington, whose mission and vision I just love, and I want to read it to you, what they are doing. They are trying to create world-class academic healthcare to be available in every corner of the globe in order to improve the health of patients in resource-limited settings through research, academic training, and compassionate care. Dr. Chung got his medical degree from the University of Washington and completed his residency and fellowship, or internship, at the Harvard Medical School and at Beth Israel Deaconess Medical Center. In addition to that, Dr. Chung in his spare time decided to get a master's of public health at the Harvard University School of Public Health. He and his family are Nairobi locals. They have lived here for 18 years, and he has an incredible family who have been really good friends to Ben and I and our kids. So Uproot, you're in for a treat today as we welcome Dr. Michael Chung. Dr. Chung, welcome to Uproot.
Thank you, Lily. Great to join you, and thank you for the invitation.
Well, I'm so delighted. I know you are incredibly busy, and listeners, this is actually the second time we're recording this because I lost the first file, and he is not only a great doctor, but a good friend. So thank you for coming back to the show.
Yes.
So let's start at just the beginning. The name of the virus I've read it differently in different sources. Coronavirus, I've read the novel virus, I've read, COVID-19. Can you just give us a quick brief primer on what the difference is in all the names that we're reading?
Yes, I think the name of the virus comes from the family of viruses of Coronaviridae, which is now what people are trying to describe this virus as, because it's related to other viruses like SARS and like MERS that we may have heard of before, or even like the common cold, that all come from this family of viruses, and that's why they called it coronavirus. And corona itself means wreath or crown, because it has a crown of protein spikes on the top of it, and that's now why they give it this family name. But because there's many other viruses underneath this family name, it's been now confusing now what name to call it, because coronavirus now means many other viruses as well. So there's actually, between the WHO and there's an International Committee on Taxonomy of Viruses, have gotten together and tried to name it. So actually the official name of it is the SARS-CoV-2 virus. And the actual disease that one gets from infected from that virus is COVID-19. So it's similar to like HIV and AIDS. So HIV is the name of the virus. AIDS is the disease that you get. Some of us in the field, saying SARS-CoV-2 is a little bit of a mouthful, so we say the COVID-19 virus. But specifically, it's called SARS-CoV-2, and that's how it's being named now.
Great. Okay, thanks for that. That clarification is really helpful. So one of the questions I hear so many people thinking about is, can a person pass on the virus even if they themselves never got sick? They never developed a temperature or the cough that we're reading about. Can they still pass on the virus, or does that just mean that they actually never were carriers?
Yeah, so that's why and so it's a very good question. It's a very important question. And something that the data is changing day by day. So, as of today, March 31st, what we're seeing is more evidence that, even if you're asymptomatic or pre-symptomatic, you may be having the virus in a way that it is possible for people to get infected. So there is that evidence out there. Now, at the same time, most people are saying, look, you're really going to get infected only if you're symptomatic. So only if you're really coughing or you're sneezing. This is now the time when you're most infectious by far. And that's when we're really worried as healthcare professionals and also as the general public to really now identify those people and isolate those people who have those symptoms. But yes, I think there's growing concern in the scientific community that the contagiousness of this virus may be from people who are asymptomatic or pre-symptomatic. So, people are now trying to take more precautions to say, okay, we should be careful about this situation and how we should protect ourselves. But this is now why a lot of the recommendations is to keep social distancing or physical distancing of really 1 to 2 meters or 6 feet apart from other people, so that even if they don't look symptomatic, you can still stay apart from them. You're washing your hands regularly and all the time so that you're not getting infected yourself. But this is a major concern. This is a growing concern. It's probably not a strong, significant contributor to the epidemic, but it's something that I think we can't ignore.
Okay, so let's talk a little bit about the different groups of people and how they're responding to the virus. I've had a couple of questions from listeners ahead of this interview who wanted to know a few things. So let me give you a few categories and maybe you can give us just a quick, I know the medicine is complex, but maybe you can give us a simple way to understand it. Kids, can kids carry the virus? Do we have kids who have actually developed COVID-19? Secondly, there's now, it seems like, oops, can you still hear me? Can you hear me, Michael?
Now I
Okay,
can
let
hear
me
you. Sorry, you got
let
cut
me
off for a
let
minute.
me
Could you repeat that?
let me pause, and I'm going to just switch my
Can you hear
internet
me
source to my
clearly?
phone. Okay, I'm going to just change my hotspot. Are you still there, Michael? Okay, I'm going to go to my phone, which
I'm still here. It may
okay.
be my internet, but I hear you now.
Okay,
Can
let's
you
see.
hear me?
I can hear you. It's breaking up a little bit, but let me just, I'm switching to tethering, so that might give us a little bit more
Breaking up.
security. Okay,
Okay. If that
how's that
doesn't work,
now?
I'll try to.
How's that?
It's better now. It's
Okay,
better now.
great. Okay, yes, better for
Okay.
me too. All right.
Okay.
So I think we got to the second question fine. So let me just move to the third, which is different groups of people and how they're responding to the virus. Some listeners had two questions. One, can kids develop COVID-19? And then secondly, it seems like in the last week, we're seeing a little bit more evidence that my age group, middle-aged people, 20-something to 40-something, are not necessarily, free from risk, as kind of the
Oh,
earlier
yeah.
messaging was more around older people. So could you talk to
Right.
those two groups of people and give us maybe the latest of what we understand?
Yeah. So, I mean, so definitely what we're seeing is that people can get infected with the COVID-19 virus at younger age groups. Now, it is less likely, particularly if you're under 20 or less than 10, that you get infected. And we're definitely not seeing a lot of morbidity in these age groups,
Okay.
but it does happen. And unfortunately, there are some very sick cases that have arisen from that and even a few deaths. So it is something that we're worried about in children, but it's not the main driver of the epidemic or in terms of morbidity and mortality that we think is there for many different reasons. And it's true too, the main people who've been dying from the disease are in the older age groups. People older than 50, particularly those older than 70, have a much higher case fatality rate. That being said, definitely what we're seeing too is that people at these younger age groups, less than 50 or between ages 20 to 40s, are getting infected and they are getting very sick too. So it's not like they're completely free from this. Still within those age groups, we're seeing morbidity that's 10 times higher than what you see with the normal virus. So it's not something that one can ignore. So is there less symptomatology? Is there less death? Yes, there's less than the older age groups, but it is significant. It's definitely much higher than the regular flu. And it's something that, if you get infected and you're carrying it and you're giving it to other people, you definitely don't want to be visiting your grandparents or your
Yeah.
sick uncle or
Hmm.
anybody else because you'll be now transmitting that virus. So I think it's something that all of us now have to take the necessary precautions for, not for only
Yeah.
ourselves, but definitely for the people around us.
Yeah, thank you for that. I think staying up to date with what we know to be true is so important. In our
Yes.
first phone call, I was telling you how I was getting lots
Mm,
of different messaging on WhatsApp, cures and take garlic and
yes.
take this and take that. And I think the more we have the facts, hopefully that will reflect in our behavior and we'll really stick to these guidelines of physical distancing and social
Yes.
distancing. Okay, so
Mm,
related to that,
hmm.
in the last week, my husband and I have been talking about the difference in outcomes for men versus women. It seems like men are getting sicker and having different kind of outcomes. Can you explain why
Mm.
that is?
Yeah, it's not clear, but you're right. I think what we're seeing in countries, at first we thought maybe this is just China, but we are seeing this in Italy, we're seeing this in Spain, we're seeing this in other countries where men are getting sicker and dying. They have a higher mortality rate than women.
Mm,
And why this is so, it's still not clear yet. The hypothesis that's there is that, men are more likely to smoke in some of these countries. They're much more smokers among men than women. They also a tendency to have higher risks for cardiovascular disease, for
okay.
diabetes, for other lung diseases. So tend to be that, men, particularly older men, are sicker, have more comorbidities than women. And this is probably affecting them negatively.
Okay.
What we're not seeing necessarily is that they're being infected more than women. In places like Korea, for example, we actually see that the majority of infections are happening among women. But one of the reasons maybe it's not, you don't have a high mortality rate in Korea is because it's infecting mainly young women. And so the youth and maybe the gender has an impact on that. So we're not sure, is it comorbidities related to male behavior? Is it also that they don't take care of themselves very well or they're seeking healthcare at the last minute like we men tend to do? That may be a
Mhm.
part of it as well. And lastly, maybe it's autoimmune. We do know that there are immune differences between men and women. Women tend to get more autoimmune diseases like rheumatoid arthritis or thyroid disease. And is this now playing a role in terms of why men are being more affected than women? So we don't know yet. It's an interesting exploration for us as scientists.
Well, one thing I'm taking away from what you said, though, is that idea of just culturally or gender-wise, if we don't seek medical care, we tend to ignore our health. This is not the time to do that. That we should be paying attention to how we're feeling, if there's any changes, and be aware of
Definitely.
that. Yeah, no matter who we are, just to pay attention to our symptoms day to day.
Yeah, this is not a time to be macho and be manly
Right.
about it and say, oh, I can get through this and I'll be
Yeah.
fine. Because part of it too, what we're seeing is, some of these patients, they're coming in and we're measuring their pulse oximeter, which is a measurement of oxygen in their blood, and we're saying, oh my goodness, it's really low, but they themselves may not feel symptomatic. They're not short of
Mm,
breath necessarily, and so that's very dangerous. And so, yeah, we don't want to have men
yeah.
feel like, oh, I'm feeling really good, so I don't need to be checked out. This is
Yeah.
this is something that you requires medical attention, at least at the beginning.
Can I ask you, do we know how this virus is treating asthmatics or if it's presenting differently on asthmatics? I
Mhm,
had a question about that, and I have kids who have asthma as well, and was
mhm.
wondering, would it look different on them? You know what I mean? Like we're paying
Sure.
attention to do they have temperatures? Are they coughing? But
Mhm.
because they're asthmatic, would it present differently?
It's an interesting question. The what we're seeing with COVID-19 virus is it's really causing a pneumonia, so
Okay.
something that is an infection of the lungs. So we're still now seeing the lungs really get damaged by this, and really now seeing like a dry cough that comes not just from the upper respiratory system, but really from the lower respiratory system. So it's a different. So it won't change the symptom presentation in that sense. It's still typically a dry cough. It's still typically a fever that's there and fatigue that's there. But what may be happening different in asthmatics is, anything like a trigger, as you may know, whether it's
Mm,
cold or whether it's food, or even especially when it's an infection, can cause an asthmatic to feel more short of breath and more wheezy. And this is now definitely one of those things which can do that and exacerbate asthmatic symptoms. So what you might see then in an asthmatic who gets infected is not only the fever, not only the cough, but now more asthma attacks, more
okay.
increased exacerbation, and more wheeziness. this is now what can happen. So yes, in that sense, they'll be more wheezy than the typical patient who doesn't have asthma. You won't have that stridor, but in an asthmatic, it'll probably exacerbate that underlying condition as well.
Okay. So again, just paying attention to those in our families who may have those chronic illnesses and how their body might respond might look a little bit different, and just paying attention again.
Exactly.
And hopefully the slowdown, while we all appreciate the heaviness of the economic impact, hopefully it's also allowing us to be more in tune with our loved ones and with our families,
Yes.
so that we can pay attention to those changes that might be occurring.
Yes.
I think something that's at the top of so many people's minds is, what do we know about the virus's ability to mutate and the rates of
Mm,
reinfection? If I get it
right.
once, can I get it again? Is it like the
Hmm.
chicken pox? Am I going to be immune forever if I get it and recover? What do we know
Hmm.
about that so far?
Yeah, so another great question, and it's $1 million question for us scientists and doctors to understand, because what we don't want to happen is that, oh, I've got COVID, and oh my goodness, I can get reinfected. Now,
Mhm.
the good news so far is it does seem to be like the SARS virus before it and the MERS virus before it, which we know with those viruses, yes, you do build up an immunity to it. Yes, you do develop antibodies that do appear to be protective. How long that is protective for is still an outstanding question, but it looks like it can be protective for some amount of time. So
Okay.
the evidence is now showing us that we are hopeful that yes, you're going to build up an immune response. It's less likely that you're going to be reinfected. And the other evidence that's coming out from that is also the fact that some people who are recovering from the COVID-19 infection are now being used to now help treat other people. So their plasma is being
Right.
obtained, and now we're trying to now say, oh, you've developed antibodies. Maybe let's put those antibodies in people who are now suffering from the disease and see whether it can help. And so those trials are ongoing even now. So again, as of today on March 31st, there are some promising results, but it's definitely, we don't have firm results to say it definitely helps, but it looks like it's going in the right direction.
Okay. And I hope now that, the world, I think here in Kenya, we're now just at the early stages. God willing, it won't grow that bad. But as we can look at Wuhan and see that they have more data, more time since the first onset, I guess we have a little bit, we understand a bit more about reinfection, hopefully at this point, right? There's at least, I'm sure the whole world, scientific community is looking at where it started and seeing, are people retesting positive?
Hmm.
Anyway, I don't really have a question. I think I'm just commiserating and talking with you, feeling comfort that
Yeah.
I can have this conversation with you, because I think that's part of what feels, because we are physically distancing from one another. I think then
Yes.
that isolation can also feel intellectual at times too. So
Well, well, the good thing for Kenya, and this is how I feel, as an American trained doctor living in Kenya, is, we've been able to buy ourselves time and really look abroad and say,
yeah,
okay, this is what happened in China. This is how they handled it. This is what happened in Korea. This is how they handle it. This is what's happening in Italy and Spain. And this is maybe not the way they handle it necessarily, or this is the danger we face. And now we're looking at America too. So, what's good and what's scary is that we can look to those results, look at how they handled it, look what they did and didn't do, and try to adapt accordingly. And I think this is now why we've seen the Kenyan government take such an aggressive approach
yeah,
to really restricting international flights, really restricting travel, putting in curfews, doing all those things which, America didn't do for the longest time. And I think they're really paying for it now. But we're like, you know what, we can't even afford for that curve to get high before flattening it. We have to
yeah,
flatten it from the very beginning. And
yeah.
so hopefully we are learning from them in a very positive way, so that if and when this is coming, we're going to be able to tackle it head on and to keep it at bay.
That's really encouraging, I think, for all of us to hear that. Yeah, that we had a chance to learn and they took advantage of that, which is great. Michael, what are you hearing from your colleagues in Seattle? Are they seeing any kind of relief now? They were the epicenter for a moment. I think that title has been
Yes.
passed to maybe New York now. But
Yes.
what are they seeing in Seattle at this point? Do you know?
It's a good question. So, definitely 2 weeks ago, it was really hot and hectic for them. I was just seeing a lot of emails of people just trying to get the emergency response team in place, trying to get a command and control structure in place, trying to bring in doctors to actually meet the needs of the patient volumes that were hitting them. And so, at the University of Washington, which I'm attached to, there was all this just movement and many emails also coming, from the state public health department, stating what they're going to do and how they're going to do it. So now at this stage, I feel like what I'm sensing is that they have a handle on it. They're on top of it. They know what's expected. They know what's coming, and they're moving along with that flow. And
Yeah.
also, what we're seeing in Seattle is, they started to institute this, staying at home, social distancing, washing hands, really closing down shops and restaurants so that people were not mingling. And I think the benefits are being seen now, a couple of weeks later, that it's starting to calm down a little bit. Now, it doesn't seem like we've hit the peak yet, but it isn't definitely the exponential growth that was there, a couple weeks ago, where everybody's like tearing their hair out, just really afraid of the next day. It seems to be flattening out a little bit, which is very promising. So I'm seeing less emails and less conversation and discussion, which I think feels more reassuring for people on the ground there.
So, listeners, wherever you are in the world, please keep washing your hands and keep staying at home. I think
Yes.
even as we see this, things start to stabilize, the only way it stays stable if we continue these measures, that we should not get overly confident and start moving around. We should continue to really observe for the health of our community. So I'm glad to hear that they are feeling some relief, and I hope that the rest of us will continue to learn from our neighbors across the world. Let's, I think, maybe shift gears and talk a little bit about some of the measures that have been put in place and how people are coping and how they're trying to prevent. So there was a Washington Post article that came out that said the CDC is reconsidering how they feel about masks and the use of masks.
Yes.
Dr. Chung, help us out here. I think this is probably another $1 million question. I don't know, but it feels
Yes.
confusing to understand what we should be doing regarding masks.
Yes, so it is really confusing, and I'm glad this is now why we have had a second chance to talk to each other, because the science is changing daily and the policies and protocols are changing daily. Um, you know, right now, the WHO and CDC is saying, you don't really need to use masks in public. We need to use them in places like healthcare facilities where we know there's a risk, and we need to use them with people who have suspected COVID or have known COVID. That being said, both in the public sphere and in the healthcare realm, we're starting to see a shift of people saying, look, there seems to be a risk here with asymptomatic or pre-symptomatic people. How do we protect ourselves accordingly? But also knowing that we have a shortage of masks out there. How do we make sure that the people who need them the most, which is now healthcare workers, are actually getting protected from masks? So where are we at now? It's what I'm seeing in America as well as here in Kenya, people really starting to say, look, in the distant past too, we used to use cloth masks. We didn't
Yeah.
have the surgical masks that were, so fancy and made in industry. We made them ourselves. Why don't we go back to that? And I think you're starting to see people start to move in that direction of saying, look, the risk is probably small from asymptomatic people. If you keep social distancing, you should be able to protect yourselves. But if you're in, why not wear a mask? It probably doesn't hurt. As long as you're wearing a mask and you're keeping it clean and you're aware of it and still washing your hands, still not touching your face, it may be helpful, particularly in crowded areas. And as we know here in Kenya, a lot of people live very close to each other. And that's something that, you may not have a choice, but to be sharing that space with someone or being in the matatu with someone. So can masks help? Maybe, probably. We're seeing that maybe we should be going in that direction. Definitely in places like Asia, everyone's wearing masks. It's part
Yeah.
of a cultural phenomenon there to do that. It's not so much in America. So I think in the West, you're kind of like going, oh, maybe we should be doing that though. So,
Mhm.
so we'll see in the
Okay.
coming days and weeks. But I think you're starting to see the more people feel like, look, if you can get masks, if you can wear masks, go ahead and wear them, especially if you're
Yeah.
symptomatic.
And when we think about masks that might just be very simple in nature, made from local materials, they kind of serve the same purpose as maybe a mask that you would get for painting or to avoid dust. Same kind of principle applies there. Just basically a way to keep spit and kind of respiratory droplets, is that the technical term,
Yeah,
from
so
distributing?
that it's the droplets, and so that's one thing that we have to be a little bit careful of. Not all masks are created equal. They're not necessarily all the same, and so definitely surgical masks. They go through their own Q&A, their quality assurance to say, okay, this will now serve that function for doctors in the medical community. So we have to be somewhat careful too. That not necessarily any bandana or scarf is going to be the same as
Right.
something like that. So, with the quality of the masks, the layering of it, how much it covers the face, all these things are probably very important factors in how protective that mask might be. So I don't know that it's something that we would say healthcare workers should use, for example, or
Right.
that we would say, this mask is definitely going to help you. But I think in the sense that we want to open the doors and say, look, let's move in this direction. I think that's positive.
Okay.
Hopefully there'll be more science out there to tell us, okay, what kind of mask should we make and what is the best type of mask to wear?
Okay, great. So I think for what I'm understanding you to say is that if you're the average person, you're forced into a place where you're going to have to be around people,
Mhm,
wearing a mask is not a bad consideration. If you
mhm.
are wanting to donate to a medical facility, that's a different kind of mask and would have its own kind of, they have their own acquisition of those masks, and we should probably get in touch with
Yes,
medical workers before we think a donation is actually going to be
yes.
useful. Okay, great. Thank you for that. I think that's helpful to hear. Just last week when we talked, it was
Yeah,
so different.
keeps
Yeah.
changing.
So what about just taking vitamin C, taking zinc, sitting outside in the sun to get vitamin D? Michael, are any of those things, sorry, Dr. Chung. I'm so used to you, my friend Michael. Now I have to give you a bit more
No, call me
respect.
Dr. Mike, Dr. Mike.
Dr. Mike, there we go, Dr. Mike. Um, so what about those things? We're trying to make our kids take some vitamin C and get out in the sun every day. Both it's good mentally, but also just wondering, is that going to help boost our immunity at all?
Mhm. So I know there's a lot going out there, in social media and the internet about how to help one's immunity. And it kind of reminds me of the time early on in the HIV epidemic. We had a lot of um, herbal medicines out there, and the same emphasis on vitamins was there as well, just because I think, we were desperate and we weren't sure what would help us and we wanted to find something. So I think, what we can say, there's no strong scientific evidence to say, okay, any of these things really help. And what we do
Okay,
know is, keep healthy by eating good food, eat your fruits and vegetables, get sunlight, go out, get exercise. These are good things. If you have diabetes, keep your sugars under control. Do all the healthy things that we know will make a difference, and that will help definitely.
okay, okay,
But taking necessarily vitamin C or zinc, we don't really know that that helps, and there could be side effects from taking some of these, medications in excess, like zinc.
okay,
So
okay.
I think that the basic message that most of us doctors are saying is, look, just keep your continued healthy lifestyle. Don't eat a lot of junk food. Stay away from a lot of sugars and carbonated drinks. And drink your juices and
Yeah.
eat whole foods.
But this is how we are coping, Michael. We are coping through sugar and wine. So I need another prescription for my health. But anyway, your
Yes.
point is well taken. Stay healthy, eat well, move around every
Right.
day as much as you can. And there's so many good resources in terms of exercise online now. I mean,
Hmm.
it's incredible what you can find for your
Yes.
kids and for yourself.
Hmm.
Let me ask you, I've got teenagers at home, as you know
Hmm.
them well, and they are kind of holding on to hope that there's something called an isolation cell that they can engage in time. So the idea we read somewhere that if us and our family have stayed inside for 2 weeks and have not had any external contact, have not gone to the grocery store, have not, done anything, we maybe walked around outside, but we haven't had any contact with anyone. And then another family friend has done the same thing, that potentially after 2 weeks of no symptoms, that these two families could now start to socialize a bit, keeping the social distancing, but perhaps could sit 6 feet away at a park or something like that and spend time together. Is
Hmm.
this kind of bad science, or tell me?
I mean, it makes sense, as much as now you are keeping among yourselves in a physical, environment that is not reintroducing virus in any way, and you're safe that way, and you've proven that, for 14 days, you have an island onto yourself that has not shown that anybody's infected, nobody's contagious, the virus is not sitting around on any table or desk or anything like this, and the other families the same way. Yeah, that makes sense that you could be able to hang out with together and feel safe together. And I think there are literally those islands around the world that are safe in that way because they just don't have introduction. And that's the same way I think as a country, Kenya is just limiting that international travel. But once you get someone from that group going out to, okay, I'm just going to go shopping one day, out
Mhm.
to the market, they may be reintroducing something. So that becomes the
Okay,
unknown factor in all of that. So yes, if
okay,
you can maintain that isolation cell, 24/7, as long as you have that in place, that's fine. But as soon as someone breaks out of that, there is that
okay,
potential then for reintroduction of the virus.
okay. And so that breaking out would include going to the grocery store or possibly even getting food delivery in, that someone's delivered food in. Is that also kind of breaking that barrier of isolation?
So that's a good question. I know there's a lot of concern raised by people. What does it mean to, get delivery of of medications or food? Does that really hurt? And so again, in those instances, the danger that's most there is not the food itself or the packaging necessarily. It's the contact with the delivery person. So it's if the delivery person can stay 6 feet away, if you're not shaking hands with the delivery person, if they're not, coughing or symptomatic in front of you, that's safe. They put the bag down, they walk away, you come and you pick up the bag, that would be the best way to do it. So it's the
Okay.
human-human contact
Yeah.
that is most dangerous. So, if people want to wash the packaging or clean it, I mean, that's fine. It probably doesn't hurt, but there's really no evidence that it really helps necessarily, and that's not the typical recommendation that's out there. But I
Okay.
could say, like, if you went out to a grocery store,
Mhm.
the food is one thing that, but I don't think that's the issue. But it's like holding on to that cart and moving that around. Now, someone else may have held on to that cart, and we know the virus can stay on that plastic or that steel for several days. That's where it gets dangerous, right? So that's where now you really want to religiously wash your hands. Or you're carrying the cart and that the shopping bag or the basket, and then that can now carry the virus, because someone else
Yeah.
has handled it outside. Or now you're dealing with the shopkeeper and you're paying for that money, and that person is close to you. So that's where you now want to take more care.
Yeah.
But yes, those instances can now cause, a possible transmission of virus.
And it seems to be, I think in our last conversation, you mentioned this is also what makes the coronavirus so much worse than the flu is it's so highly contagious. I mean,
Yes.
that is just,
Yep.
it's just so easy to pick it up and it lives for
Yes.
such a long time on these surfaces that are so common. I mean, grocery shopping
Yes.
will never be the same again, I think. When we get through this, we will never look at a grocery cart the same way, you know?
Yeah, well, I don't think we'll look at socializing in the same way
Yeah,
either. I
true,
think
true.
it'll be a very different world when we come out of this.
Yeah,
But you're right. I mean, that's another message is that the COVID virus, compared to the regular flu and even the cold, is a lot more contagious for sure. Like, 2 times more contagious, at least it seems.
okay.
And the mortality rate, it seems to be maybe
Mm,
at least 10 times higher,
mm,
at least. So it's definitely one of those things where it's a bad combination. It's the infectious diseases doctor's worst nightmare, in
yeah.
terms of what can be contagious and what can cause a lot of sickness.
Yeah. Well, and I'm very aware that I'm really holding your time. So I'm going to try and move quickly here to kind of my last few questions. The Cabinet Secretary for Health, Mutahi Kagwe, this week or yesterday said that basically now here in Kenya, we know the
Mm,
virus is here, that the community
yeah.
spread is beginning. We are living with the virus and all the very good efforts to keep it out, they
Mm,
probably did save us, probably many, many more instances, but now we are thinking about community spread. And I
yes.
think as we think about that, we're also thinking about what do you do if you start showing symptoms? How can you care for yourself? So I'd like to just spend our last few minutes thinking about that, Michael. And I think it's important for people to understand if you develop some of these symptoms, the cough, the fever, how do you take care of yourself at home?
Yes. So first, if you're having a cough and you're having a high fever, I think these are now situations where, you want to be checked out, or you want to make sure are getting ruled out for COVID if you can. So what the recommendation is today, with the Ministry of Health, is that you call their hotline number, and they will direct you, to a facility that has the testing and has the facilities to help you out. So then you know where to go, where to get tested, because the testing again is what's going to help us the most. So I think what I want to put out there is the testing will help you. We now know it's community spread, and it will help the public and us to know, okay, who has COVID
Okay.
and how can we help you and isolate you and make sure you're better. So what we don't want to have do is people just hiding away and not really getting out there. We need to actually know this, and we need to help you in that sense. Now, what the Ministry of Health and the facility may say is, you're actually okay. You may have COVID. We'll rule you out, but you can probably take care of yourself at
Okay.
home. And that's another big message here is that, the vast majority of people are going to do fine. They're going to feel crappy, for a couple of weeks, but 80% of people will have just mild symptoms and they'll resolve on their own. So what's happening now is people are saying, look, you can probably go home and take care of yourself at home as long as you now can isolate yourself from other people. So the main danger there
Right.
is now spreading it to family or friends or roommates that are in the same compound. So can you get your own room? can you get a caregiver that can give you the food, that can feed you so that you don't have to go out shopping for yourself?
Right.
Uh, that's, I think, the main question there, because it's sort of like the regular flu in that sense. It feels worse from what I'm hearing, but it's something where you stay well hydrated, you stay well fed, you take paracetamol or acetaminophen for the fever, and you're gonna get through it. And for the pain, you'll get through it. But you need to have that facility where you can be by yourself and you're not spreading it to other people. So it remains to be seen what's going to happen as we move forward in this pandemic for Kenya. Will we continue trying to isolate people at home to treat themselves at home? Because what has happened in places like China and Korea is they've created field hospitals where even if it's a mild symptom, they don't want to send you home to take care of yourself. They want you
Okay.
actually isolated in that field hospital where, you know what, you're going to get better. You don't need oxygen, but you know what, it'll isolate you and prevent wider spread. So is that something that Kenya can do? It's something that we may need to explore if this gets much worse.
So for our friends who are not in Kenya listening to this, I know we have family members across the globe who actually were traveling right before it became declared a pandemic, who exhibited symptoms. And I think the advice they were getting was stay at home,
Yes,
just because they don't have the tests available a lot
right.
of places now. One thing I've heard, I don't know if this is true, that you should avoid ibuprofen and really try
Hmm.
and so stay on paracetamol and what was the other one you said?
Acetaminophen and paracetamol is
Acetaminophen.
the same as
Okay.
Tylenol.
Same
So
as
yeah, I
Tylenol.
think what we're seeing is that you know ibuprofen is the same thing as NSAIDs or nonsteroidal anti-inflammatory drugs. And with the SARS virus before it, when we are using those drugs, people seem to have gotten worse. So yes, I think if you're going to break a fever, use Tylenol, use this drug. Don't use the ibuprofens uh,
Okay.
and the Advils of the world. So that's correct device. Now, to get to also your point about testing, so that is a key issue here, and for us in Kenya too. Do we have enough tests to test you? So, what we are seeing in the scientific community is, what we want to get testing out there as much as possible. We want to test and get to know if you are positive so we can isolate you appropriately. But you're right that in parts of America, and Seattle included, people were saying, you know what, just stay at home and take care of yourself because we don't have the test to test. We don't have enough test kits out there. And that's okay, but that's probably not ideal.
Mm,
And so we probably need to get to a point where we are testing you, even if you're sick and you think you have COVID.
okay.
But yes, the messaging is going to change, depending on how widespread the epidemic is, how much community spread there is, and how much testing is available, and how much facilities are available to be able to isolate people, outside their home.
Okay. And listeners, will definitely link in the description of this episode where in Kenya you can call, because there are hotlines set up at several
Yes,
facilities to make sure that you get the information. Like you said, time sensitive, it might change tomorrow.
yes,
Um, Locally too, I just want to clarify, I think that Panadol is our version here, right, of Tylenol?
yes,
Michael, is that correct?
yes,
Yeah, okay.
yes,
Just so
hmm
that I know it'll be different depending on when people are listening.
yes.
So is there a clear marker if you are kind of taking care of yourself at home? Maybe you've got a bit of a cough, a bit of a fever, but you're comfortable relatively. At what
hmm
point when your system's symptoms change, do you know, okay, I need to get medical care? This has gone beyond,
Right,
I'm sure we all have that pain threshold. It might different. My
right.
pain threshold might be different than yours. So what is that crucial point as a physician that you're thinking, okay, now I would want to see this person?
I think that a couple of things. One is definitely this being a pneumonia and an infection of the lungs. We want to get to you before, you are too short of breath,
Okay.
that we can't help you. So if you need oxygen, we have oxygen for you in the hospitals. We can get you oxygen. So being short of breath is a key indicator. So you have to be able to feel like you can breathe on your own. You're getting enough oxygen, and that's key. Number one. Two, if you're coughing and now you're coughing up blood, or the cough is not going away, and the cough is with that shortness of breath, this severe symptomatology is also indicative of more severe disease, and a more
Okay.
severe pneumonia. And we want to get to you, want to give you the oxygen, and maybe possibly have to intubate you and breathe for you if we have to. Thirdly is, having a high fever that doesn't break. You're just having a fever and it's just not getting any better, and you're having it difficulty getting out of bed. Maybe you're getting too dizzy getting out of the bed. Maybe you're not able to, move around. So those are warning signs that, you know what, this infection is taking hold of large parts of your body. We need to control that. We need to sort of stabilize you in other ways. And that gets to the fourth point too is, for all of these things, you need to have a caregiver. And you need to have someone who's around to actually help oversee that. If you're getting too sick, you should be, they can give you food, they can give you water, they can give you the medicines you need. And, if they're not around, then they can take you to the hospital, because not having a caregiver around is also a very dangerous sign. If you have a caregiver who's like, oh, I have to go to work today, and so I can't keep an eye on you, that's not good either. And that's
Yeah.
also can result in severe um, morbidity and death even.
Yeah, I was talking to some loved ones who are single and live alone. And, in light of this idea that, what if something happens to me and someone's not around? And I've
Right.
seen people, they're developing WhatsApp groups just to check in with friends every day,
Yes.
just every morning, just doing a
Yep.
health check. How you
Yep.
doing? And I think that's a small way that all of us who are not single can check in on those loved ones who are single, or a
Yes.
grandmother who might be living
Yep.
alone, or a cousin or whomever, just check in every day. I think as much as we are physical distancing, I think that social emotional connection
Yep.
is still really important in this time.
It's very important. And what we're seeing, unfortunately, is, some people getting sick pretty quickly. So it just seems to be doing well, they're doing well, and all of a sudden they turn a corner, especially if
Yeah,
they're older. So yeah, that type of check-in is going to be key here to make sure that they get help at the right time.
yeah, yeah. So don't go to their houses, but friends, we can definitely check in on
Yes.
our loved ones in other ways
Uh-huh.
through technology. Um, a patient once, I think you referenced this at the beginning in terms of being asymptomatic, but let's say you've had COVID-19, you've recovered.
Mhm.
How much longer of time are you still contagious? Am I a risk to somebody?
Yes, another $1 million question. So we're still trying to figure that out. But I think right now there's two guidances. One is that you can get tested for COVID-19, so you can actually have the same test. And if that test, which tests the amount of viruses there, is low, that's one way to say that you're clear. Because definitely what we're seeing in some people is that after a certain point, they've cleared the virus, but what's going on is the immune system is just fighting
Hmm.
what was there, and that's what's causing you to get sick. So one is testing. The other way is to say, and this is now CDC guidelines, is that you should at least be 7 days out from the onset of symptoms,
Okay.
and 3 days out from the resolution of those symptoms. So whichever is longest, or some
Okay.
combination of that.
Okay. Great.
So basically, at least 3 days after the resolution, complete resolution of symptoms, and now 7 days after the initial symptoms is what we're saying is the safe window to say that people are not contagious.
Great. Thank you. That's helpful and clear. So thank you for that.
Yes.
I know I said I only had a few more questions, and I am trying to make good on my promise. I guess I'll maybe end up with just with two last questions. One, are there any hopeful developments that you as a physician, as a researcher, as a scientist are looking at and seeing in the data that's making you feel hopeful about our next several months of coping with the coronavirus and COVID-19?
Good question. So, frankly, I think what's giving me most hope um, is that idea that, the quarantining that's happening, the social distancing that's happening, the sort of closing down of people getting together and making them stay in their homes, that's making a difference, right? So we are seeing that flatten that curve and making a difference in places like America. What's also promising is seeing, the success of places like China and Korea, and saying, okay, how did they do that? Oh, they put up field hospitals to isolate people, even with mild symptoms. Oh, they really tracked and traced everybody to really find out their contacts and make sure that, we're following up on them and testing them. That we're actually, by testing as many people as we can, both from a medical point of view and a public health point of view, we're really making a difference in identifying people and then dealing with it quickly. So
Mm.
it's these public health interventions really that are, in my mind, making the biggest difference. And we're seeing, if you're active, proactive, and aggressive from the very beginning in doing these things, you're going to be able to make a difference. You're going to be able to get less people sick. I think your question is also about, the individual and the treatment. And,
Yeah.
again, for that, we are moving towards now using hydroxychloroquine, which is used for malaria as a drug. But I think it's important to know that, this is not something that has been proven to be effective. We're kind of in this quasi-desperate stage of saying, you know what, this looks like it may have some effect in the test tubes. there's one small trial in France that may suggest it could be shortening the disease course somewhat. So let's try it. So we're all trying it. But it wouldn't surprise me if a week now, the clinical trial said, you know what, this doesn't show any
Yeah.
difference. You need a randomized control trial really to show us whether that makes a difference. So in the meantime, we're throwing the book at it. We're doing a lot of clinical trials. We're throwing a lot of drugs at this. We're even testing vaccines now. But nothing, frankly, is really on the horizon for this as saying, okay, this is the magic bullet that will cure the disease. We're hopeful, but it's probably going to take time.
Yeah. Well, and I think I'm glad you mentioned hydroxychloroquine, because as somebody who has dear friends living with lupus, I think
Mm-hmm.
the public health message also is do not go and stockpile this drug. There are
Right.
people who need it every day, and it's a very selfish way to approach this. And when if it does become a treatment plan, I'm sure there will be
Yes.
an appropriate response that will be recommended.
For sure. And even then, hydroxychloroquine has its own side effects, and it can
Right.
severely affect the heart. And I think there has been news media reports of people like making their own concoction and killing themselves as a result, which is very sad. But it's just to know that, these drugs are not without their own effects. So one should be very careful of them. So stockpiling is definitely not going to make a difference. And there's definitely not the data to show that this really helps. And we need to
Yeah.
get it to the people who really need it.
Great. Well, I could have talked to you for several more hours, but I'm so grateful for your time. I know many people are requiring your expertise and your help. And once we get through this, I'm going to make you the best Ethiopian meal and coffee ever had.
I don't
I
want to
owe
wait till we
you.
get through this because that may take too long. So
I know. Okay. How do I make this happen? Social distancing,
maybe
God.
soon after I know, maybe we can do some delivery or something like this.
We'll figure out a plan. I will figure out a
Okay.
plan. But thank you so much, Dr. Chung, for your time,
Okay.
and to all of our health workers and your colleagues who are fighting so hard to keep us
Yes.
healthy. Thank you so much.
And thank you, Lily. Thank you for the
Okay.
opportunity.
Talk to you
Bye-bye.
soon. Bye-bye.